How has osteosarcoma prognosis changed? Osteosarcoma prognosis has seen significant changes over the years, particularly due to advances in treatment. In the past, the 5-year survival rate for osteosarcoma was around 20%. Today, that rate has improved to about 60 to 70% for children and adolescents. This change is largely attributed to the introduction of multi-agent chemotherapy, which has transformed treatment approaches since the mid-20th century. From 1975 to 2020, childhood cancer mortality rates dropped by more than 50%. For osteosarcoma specifically, the 5-year relative survival rates increased from approximately 40% to over 70% in children under 15 and adolescents aged 15 to 19. Current statistics show that localized osteosarcoma has a 5-year survival rate of about 77%. However, if the cancer has spread regionally, the survival rate drops to around 60%. For those with distant metastatic disease, the survival rate is significantly lower, at only 25%. Despite these improvements, the progress has plateaued since the 1980s. No major breakthroughs have significantly increased long-term survival rates beyond what has been achieved with surgery and established chemotherapy regimens, which include drugs like methotrexate, doxorubicin, and cisplatin. Prognosis can vary greatly depending on several factors. Age and the stage of the disease at diagnosis play crucial roles. Pediatric patients tend to have better outcomes, with 5-year survival rates ranging from 65 to 78%. In contrast, older adults may experience much poorer survival rates, sometimes as low as 25%. Early-stage, localized tumors are associated with a much better prognosis compared to metastatic disease, where 5-year survival can fall below 30%. Several prognostic factors influence outcomes, including tumor size, location, whether metastases are present, and how well the tumor responds to chemotherapy. Genetic factors, such as changes in chromosomes and specific gene mutations, may also impact prognosis, although they are not yet routinely used to guide treatment decisions. Emerging treatments are on the horizon, with new therapeutic strategies like targeted therapies and tyrosine kinase inhibitors showing promise in early trials. These treatments aim to inhibit tumor growth and the pathways that lead to metastasis. However, they require further validation through large clinical trials before they can become standard care. Concerns about side effects and the long-term impacts of these new drugs remain important considerations. In summary, while the prognosis for osteosarcoma has improved significantly since the mid-20th century, especially for younger patients, progress has slowed in recent decades. Metastatic osteosarcoma still presents a challenging prognosis. Ongoing research continues to seek more effective and less toxic treatments, emphasizing the importance of early detection, understanding tumor characteristics, and considering patient age. This highlights the need for personalized medical care from specialists in bone cancer.